morning, Her Royal Highness, the Princess Royal, and good morning, ladies and gentlemen. And thanks to Semex for inviting me to come and speak here today. From the minute that they asked me to come, I felt really honoured and really excited, and I felt like that all the way through, and I still feel like that now. So, and thank you to all you for coming along to listen after what was, for some, quite a heavy night last night. I do appreciate the fact that you've turned up, and I will do my best to make it worth your while. So, I've been asked to talk to you about the future of dairy cattle disease. It is a pretty wide subject, and I could talk on lots of diseases for a lot of time. So what I did was I chose what I perceive to be a couple of important areas in the context of today's and the future of the dairy industry. And I'll explain why. So, different components which make up your business, and I'm very aware that there are a lot of elements to your farm business. So there's nutrition, staffing, agronomy, fertility, and economics, which is forefront in our minds at the moment, and we've heard a lot about. There is animal health, and of course the most important thing is milk production. So animal health is my area, and as a vet, I think it's really important that I'm able to see the bigger picture. But it's also important I'm able to effectively speak up for the importance of animal health and welfare. Because after all, it's all about the cow. Now, I'm an accountant's daughter. I've got no connections, no historical connections with cows or farming, no family who farm. And when I first went onto a dairy farm, I was in second year vet school. And it was funny, really. As soon as I walked on, I knew immediately that that's what I wanted to do. I wanted to work with cows. It's quite hard to describe. Because it's not just about the cows, though, is it? It's about the lifestyle, and it's a lifestyle that you have mostly been born into it. And you probably don't think about it consciously on a daily basis, but I sort of had to. I had to learn it. When I first went into a cowshed, for example, I had to consciously think where to stand and how to be. And I do feel really privileged to have an insight and be a little part of this world. So I'm hoping, therefore, I can offer something back, really, in the form of somebody from the outside looking in, but hopefully who understands the dairy industry enough to maybe point out a few things that perhaps you might not think about on a daily basis when the milker calls in sick or just doesn't turn up at all. Or when a cow falls down in the yard and hurts a leg, or when the scraper tractor breaks down. So now I've got my own practice, which actually is a veterinary practice, farm animal only veterinary practice, called Evolution, and it's in the heart of the Southwest. And I see my clients' challenges as my challenges. Now, I don't have a crystal ball, but we do need to consider emerging markets. And I think we have a future dairy industry. I wouldn't be standing here talking to you now if I didn't think that. So in 7 years, the demand for milk in China alone is going to double from 4 to 8 billion litres equivalent. And consumption is only going to grow from there. We are going through a difficult time now, of course, but we've got to look ahead and think about what the future could hold. And to meet this demand, imports are going to have to come from somewhere other than New Zealand. And they think, namely, that they're going to be Australia and Europe. So closer to home, this slide shows the Dairy 2020 project. And what that is, it's a group of organisations within the industry. And what they did was they got together and they looked at various areas, various factors, which they think over the next 10 years is going to affect the dairy industry. So they looked at, firstly, the predictable factors, what we know is going to affect our dairy industry. We know that climate change is going to affect it. We know there's a growing global demand for dairy. We know about increased costs and how much that is affecting all your businesses. And very importantly, people's increased interest in their own health and well-being. And then they also looked at the uncertain factors, what we're not sure what's going to happen. And that was mostly concerned with these people's increased interest in their own health and well-being, because how is that going to manifest? So there's people who really have very little interest in where the food's coming from, as long as it's cheap, safe, and easy to get hold of. And if the world consisted of just people like that, then maybe it would result in more mega dairies springing up on a much more global scale. But then, of course, there's the other people on the other extreme who want a story behind the food. They want to know where it comes from. They want to know that their eggs come from a farm just down the road where there's a few hens scratching around in the farmyard. Well, people like that are going to produce the opportunity for more niche markets, so more local businesses. So those guided by these long-term principles will hopefully be able to have a bit of a positive outlook and hopefully not focus so much on the short-term prospects and what the milk price is today. Of course it's important, of course, because we've got to still be here next week, next month, next year. But it's so important to be able to look ahead and see what the future holds for us. So, your bright future, and what's going to challenge it from a veterinary perspective? So 2 areas I want to speak about today. I want to speak about Johne's disease. It's really important. And I want to speak about responsible use of medicines. Now, yesterday when Gwyn Jones put his slide up, I had to resist the urge to rush out immediately, go back up to the hotel room and completely rewrite my entire presentation. But hopefully, I think I will only overlap slightly because I'm looking at it from quite a different perspective. And you'll notice that there aren't the big diseases such as mastitis and lameness on this slide. And it's not because I don't think they're important. Of course, they're important on many levels. But it's because I feel that you guys you're already addressing these properly and appropriately. The farmers, they seem to have a good grasp of these diseases and seem to understand the importance and the economic impact on their businesses. And certainly a lot of our farms are really quite on top of these diseases now. So these two topics are topics that I think need more, better, and different attention in order to get on top of them in the future. Johne's disease, to my mind, is a major threat to our dairy industry. So I'm assuming that most of you know a bit about Johne's disease, you've come across it. You'll know that it's an incurable, chronic condition that affects the intestines of dairy cows. And they usually pick this disease up when they're calves, but they don't tend to start showing clinical signs until they're adults. The main reason why I feel as though it's a major threat is because farmers don't seem to recognise it as a threat, and therefore we're not really doing enough about it. And I just worry that by the time we as a nation realise the impact that it could have, that we might just be a bit far down the line, and then it's just going to be even harder to manage it. So it really is a worldwide disease, and there are no countries in the world that have actually looked for Johne's in their ruminant animals that haven't found it. So this slide just shows a few studies that have been done around the world looking at how much Johne's there actually is. So one of the UK studies which was done, what it does is it looks at the proportion of farms that have had at least one case of Johne's on the farm. And it was found that nearly 35% of UK farms have Johne's to some level or other. But looking at similar studies in other countries, Netherlands, 55%. Denmark, 47%. And look at the USA, look at the States. 82% of their farms have got Johne's in some degree or other. 82%. So, here is why Johne's is such a time bomb. Ooh. Oh, there we go. Okay, so this is the way you could easily look at yonis. So here we've got a cow, she's got yonis. She's showing the classic clinical signs of yonis: weight loss, scour, easy to recognise the disease. And you think, farmer looks at this cow and thinks, yep, she's got it. I'm not going to be able to save her. I'll send her down the road. Job done. It's all going to be fine, all going to be fine. But actually, this is what's actually happening. So here is your clinically affected cow, the one that's obviously got yonis. All these cows here all appear to be completely normal. But every one of these light green cows has got yonis, but we don't know it, and we don't know which ones they are. And that's the reason why we've got to test, we've got to look for it, and we've got to be able to identify it in our cows. You need to be in control of this disease. The disease has to not be in control of you. So, is yonis a big threat? Well, this was a study done by a colleague of mine, Peter Orpin, who's a practicing vet also. And he did a survey of 200 dairy farmers to ask them what they perceived to be the most important diseases that would affect them and our industry. And TB was up there, clear winner, understandably, very topical, very emotive subject, affects, I know, a lot of people in this room and us as a business as well. And then BVD, lepto, close second. Look at yonis down there. So again, the fact that it doesn't seem to be considered as a worry is one of the things that's making it even more of a threat, because it's not being managed. So this cow has got yonis. Now, do you think it'd be better to sell this cow like this, take her to the market, sell her as a barrener? Or what about selling a cow when she's at this stage? So she's gone clinical, she's losing weight, she's not looking great, she's probably quite well in herself, probably quite bright, still eating, probably not giving her any milk. You could get her on a lorry, you might get a few quid for her. Or what about sending a cow like this, where you have to pay the slaughterman to come and take her away? I know which one I'd rather send. And the thing is, it is possible to do that. It is possible to send that first fat cow if you know she's got it. Because if you find it in that cow, it gives you the control and it puts you in control of the disease. When we have a farm in our practice that we find yonis on, and we feel like the farmer needs to understand it, needs to act on it, and we've just got a little presentation that we put together, about 10, 15 minutes long, and we put it on our laptops and we take it into the kitchen and we sit down with them, have a cuppa and go over it. And this is a slide from that presentation actually, and what it is it's just telling us about a study that was done, and it shows us that on average, yonis cows give less milk, more lame, they're more likely to get mastitis, and they get generally more sick. So, is there a connection between yonis in cattle and Crohn's in people? And how is that relevant to us and our industry? Well, Crohn's is a chronic, untreatable intestinal condition of people. So clinically, it's very similar to Johne's disease. And it's long been thought that drinking milk or eating meat containing MAP, the bacteria that causes Johne's, could potentially cause Crohn's. So there's been various studies done looking to try and find this connection that people seem to think must be there. And the NHS website states, this is taken from the NHS website, people with Crohn's are 7 times more likely to have traces of MAP, the Johne's causing bacteria, in their blood compared with the general population. Now at the moment, that's only a correlation. And correlation doesn't necessarily mean cause. So, what do we know? Well, we know that Mycobacterium avium paratuberculosis, which I'm going to call MAP from now on, it's quite a mouthful, it causes Johne's. We know that Johne's disease resembles Crohn's disease in many ways. And we know that MAP is consistently found in people that suffer from Crohn's disease. I went to a conference quite recently on Johne's, and Michael Collins from Wisconsin University was speaking. And he's renowned for his knowledge and the work that he's done on Johne's disease. And I'll just quote something that he said. The only remaining question is whether MAP causes Crohn's, or whether Crohn's patients merely become infected with MAP after they have the disease. But with Johne's bacteria being found in tiny amounts in baby formula and in pasteurized milk, public perception could be what makes it that we need to produce a test-negative product. When it gets to that stage, it possibly won't matter about the correlation between the two, whether there is or there isn't one, or indeed even what the science says. Once the public, or if the public, associate that carton of milk with the possibility of getting Crohn's disease, rightly or wrongly, that could threaten us, that could threaten our market. So, how are we going to get to the point of doing what the public may well ask of us? The answer is, I don't know. But what I do know is I think it'd be just best if farmers recognised it themselves, looked at the importance of Johne's, looked at how it affected their farm, knew their own status, and started to put control measures in place themselves. My concern is that that's not going to happen quickly enough. So, do you need to have a Johne's plan? Short answer, yes. And it becomes even more relevant if your farm falls into any of these categories. So, clinical cases, if you have clinical cases on your farm, if you buy in a lot of cattle, if you buy cattle in from other countries that have got Johne's, especially if their prevalence of Johne's is higher than our own, and simply if you've got a large herd, so 500 cows or more, they all put you more at risk of having Johne's, and you need to know what your status is. So there is a National Johne's Management Plan, which is just about put together now, and it's been put together by the Johne's Action Group, which includes organisations such as the NFU, the RABDF, NMR, and 80% of milk processors are behind it, and it is due to be published. It's out in draft now, and I think you could probably find it now in draft on the internet, but it's due to be published properly by the 1st of April this year. So I would urge you to watch out for it, use it, and use your vet and ask your vet to help you with your Johne's status on your farm. So advice to our clients, this is the advice we give to our clients. If you test one cow quarterly for a year, so that's 4 times in a year, by the end of that year, if she's carrying Johne's, you've got a 76% chance of finding that cow that's carrying Johne's. Removing cows before they become clinical, it costs you less money, and also it reduces the chances of the cows shedding, and therefore it's spreading around your farm. And finally, and really importantly, it's much easier to keep Johne's out if you don't have it on your farm, or to stamp it out if you find it very early, than it is to manage it once it gets to quite a high level. So, responsible use of medicines. Very topical area, and it was covered, as I said yesterday, in some depth. And the conversation around responsible use of medicines often focuses on antibiotics and the use of antibiotics. And that's really due to the resistance issues which we've been experiencing worldwide, mostly in human medicine. But responsible use of medicine also covers areas such as preventative medication, like vaccination. And also, a really big and important area is the role of pain relief in our farm animals. Now, I feel that we a privilege to have access to these medicines. And what it does is it enables us to be able to give our animals the best care. And my concern for the future is if we're not seen to be using these medicines in what's considered to be a responsible fashion, then we might lose that privilege completely. And to me, that can only really have one outcome for the welfare in our animals. So, I as a vet, you as livestock keepers, we've both got responsibilities to our animals and to maintain a certain standard of welfare for them. Two important ones, in which the role of medicines are paramount, are freedom from disease and freedom from pain. So freedom from disease, when looking, antibiotics falls quite nicely under that area. So when looking at using antibiotics, I always think of it as there's 5 right ways to use antibiotics, which will give you the best result for that animal that you're treating now, but also will have the smallest impact and the smallest contribution to the whole resistance issues that we're experiencing in human medicine, mostly worldwide. So it needs to be the right medicine. You need to use it at the right time. Importantly, it has to be the right dose. And you have to give it in the right way. And you have to give it for the right length of time. Stick to that, and things should be fine. And just a little point on preventative use of antibiotics. Again, mentioned slightly yesterday. We are, as an industry, under some pressure to reduce preventative use of antibiotics. And that is going to have a direct impact on something that most of us, or dairy farmers, do routinely, and that's dry cow therapy. So most of you will dry your cows off at the end of a lactation to give her a rest before she calves in again. And most of you will infuse her with antibiotics. And what that will do is, if there's already an infection in the udder, it will help to remove it. And it will also prevent an infection from setting up in the udder, so reducing the chances of, for example, calving in with mastitis. But there are certain classes of antibiotics which are being blamed for driving this resistance. And it's my personal belief that very shortly it's going to be unacceptable to certain milk processors that blanket dry cow therapy antibiotics are used. And it's possible that it's going to be a requirement that we use selective dry cow therapy in some situations. So what that means is that instead of treating all your cows with antibiotics at drying off, you look at the history of that cow and you treat only the cows that are at high risk of either being infected already or becoming infected. And it's a good theory, and there's a lot of evidence to support this, to suggest that on certain farms that experience a certain pattern of mastitis, it could be the way to go to help to control your mastitis better. And again, it would be great for farmers to look into this, to look and to see if it is something that would affect your farm and could benefit your farm, and know the reasons why you are doing it, or know the reasons why you're not doing it, before restrictions are actually imposed upon you. So in our practice, we have introduced selective dry cow therapy onto a few of our farms, not without some trepidation, I must admit. But so far, you've got to do it properly. You've got to do it in a considered way, but we have had success. So vaccinations, there is some onus on vaccinations to be used as a preventative measure and to prevent infections. And I think everybody in this room must be familiar to some degree or other with vaccinations. And it's taken me the best part of 13 years of being qualified to realise that when I make up a vaccination protocol for one of my farmers and I take it and put it on the farm, I can't just assume that what's written on that bit of paper is actually going to happen to the letter. Because people get confused, they forget, they get behind, they realise they've done it all wrong and have to start again, but because they've got to start again, they can't follow the protocol, and so it goes on. But what I do know is, to get the best out of your vaccinations, you've got to use them properly. And if you're going to spend that money on trying to get the best out of them, you might as well try and use them and get the most out of them and do it properly. So now, I do spend quite a lot of my time ensuring that the protocols are stuck to, make sure the protocols are practically possible to follow, make sure it fits in, ring my farmers up to remind them that such and such is due on such and such a date. And just to try and ensure that what's actually on paper is also happening in practice. So, the role of pain relief in farm animal medicine. There was a time, not that long ago, when it was believed that babies couldn't feel pain, and horrendous experimental things were done to them as a result. And we've all known for some time that cows do feel pain, but we haven't really thought much beyond that. So when I was a student seeing practice in Cheshire, I remember going and removing a cleat, doing a cleat amputation operation. Fairly common practice. And a few days later, we went back to check the wound and we changed the bandage. And the cow was clearly in some degree of pain. And I said to the vet that I was with, I said, oh, is she going to get some pain relief then? And the vet said, well, the farmer's likely to object to that because of the cost of the medicine and also because of the milk withdrawal that's associated with it. And so the cow got no pain relief. And it's just that, it just always stayed with me. It's always stayed with me, that has. And when I started my own practice 7 or 8 years ago, I made a conscious effort to start to introduce anti-inflammatories onto our farms because I wanted to give the farmers the opportunity to see that when they used pain relief, it did make a difference. And my aim was to make it the norm in our practice, make it the norm on our farms. So a farmer didn't actually consider the cost, weigh up what he should do. He would just see a cow in pain and he would reach for some anti-inflammatory. So when a farmer came in the other week actually and he bought a bottle of anti-inflammatory from us, I did ask him, I said, oh, what are you using this for then, mostly? And he said, every time a cow calves down, she gets a shot of this stuff. I said, oh, yeah, right. Why is that then? And he said, they just do better. So many people, when they ask me what I do for a living and I tell them I'm a vet, very common response is to say, oh, that must be really difficult because animals can't talk, can they? They can't tell you what's wrong and what they're feeling. And yeah, that's true. There is some truth in that. So in order to quantify how much pain is being experienced by animals, we have to observe them, measure them, and test them. So this has been done. And we've looked at parameters such as physiology, behaviour, pain sensitivity, and really interestingly, looked at performance as well. And it was found that in order for performance to be affected, the pain levels had to actually be very severe. And when I was a student, we did a lot of pathology. So we used to get sets of lungs come in from the abattoir, and we used to examine them, and that's how we learned. And these lungs came from what apparently normal animals that just walked into the abattoir, had no history of illness or anything wrong with them. And often some of these lungs had hardly any normal tissue in there because there was so much pathology. And these were animals, normal animals that had walked into this abattoir. And so what struck me about that was that animals, well, these type of animals anyway, have got quite an extraordinary ability to mask the symptoms to a high degree. So maybe next time when you see an obviously lame cow in your herd, one way to look at it is that she's in so much pain she can't actually mask it. So I just want to talk a little bit about the relationship between me, the vet, and you, the farmer. So various studies have been done on this, mostly in the form of surveys asking farmers what they want from their vet and what they'd like to have more of in the future. So criticisms, too expensive, quite a common criticism. Others were offering impractical advice, was a criticism. And another one that was which was heard was vets not being proactive enough. it was found that most farmers associate the vet with the routine fertility visit where you come every week and scan the cows. And a few farmers did actually say at that point that it was, they used that as an opportunity to pick the vet's brains and to ask them issues in relation to other areas of cow health, and just to chat to them about the farm, ask them what they think about what they're planning to do, etc., etc. And I definitely experienced that, no doubt. I do get my brains picked during these sessions. And the qualities that farmers are looking for in vets, well, they were found to be knowledge, experience, proactivity, and the ability to listen. So this table was taken from the Philip Lowe report, and it's a survey of 120 farm vets, so vets this time, not farmers. And they were asked what they considered to be their main area of expertise. And it came out, the top one came out to be reproduction. So that really relates to these routine fertility visits. And it's true, the regularity of going to these farms does breed familiarity with what's happening, and it develops trust between me and my client. We get to know each other's strengths and weaknesses, and we're able to tell when there's a problem brewing. But, dare I say it, telling a farmer whether or not a cow's in calf is not massively skilled. It's important that it's done properly, of course it is, and it's really useful for us to be on the front line to help make fertility decisions. And of course, we are trained in reproduction, and we can tell you what's on an ovary and how big it is and why it's there and how long it's likely to be there and then what's going to happen. We can tell you all that. But to my mind, it should be health and production that's at the top of this list, because it's health and production that I feel is going to benefit your businesses the best. In today's industry, I see dairy farmers as entrepreneurs. Not like in the old days where I used to be seen as a gatekeeper of knowledge and they'd come and ask me for knowledge. They don't come and ask me for knowledge anymore. They find their own. They look it up on the internet, they Google it. But this knowledge, it still needs interpreting. So all this knowledge that they get, which of it is correct? And do we have all the relevant knowledge? And it becomes this chaos of unsorted facts. So maybe as vets, what we need to do is we need to adapt from this gatekeeper of knowledge, and we need to become a guide through the jungle of knowledge. I feel as though it's our responsibility in the farm vet industry to make it clear to farmers that we do have more to offer and that you do get a benefit from having health and production input, and we have worked really hard to do this. And so maybe that way, some of these worrying slides I showed you earlier about the onus on yonis and how important or how unimportant it is and that farmers perceive it to be, will become a thing of the past, and we'll be able to work together to put these issues right. So to summarise, Johne's disease is a major threat. Are you ready? The responsible use of medicines, we've got to use them properly or risk losing them. And as for us vets, let us be that guide. Let us guide you through that jungle. Thank you.